Okay, joining us now to talk about this is Birgit Umaigba. She is an ER registered nurse and clinical instructor at Centennial College, an ICU nurse as well. And she joins us from here in Toronto. Birgit, thank you so much for joining us. You and I have chatted a number of times, and this weekend is no exception. We're aware of a number of ER shortages, particularly here in the province. People send me the information, they send you the information. But just a few days ago, we heard Premier Ford said, he said, "I want to be clear. Ontarians continue to have access to the care they need when they need it." That's not the case this weekend, is it?
Thank you so much for having me. That hasn't been the case for a very long time. We've been calling on the government to address the nursing shortage for quite a while now. Unfortunately, Ontarians are not getting the care that they need. 9 out of 10 patients are not being seen, just like the Premier said. I'd like the Premier to actually visit a local ER or an ICU and see what's going on. It's not enough to say 9 out of 10 people are getting the care they need. That's absolutely not true. Doctors have confirmed that, nurses have, respiratory therapists have, and nursing leaders have confirmed that Ontarians are not getting the care that they need. So who's lying here? It's so tragic. People are suffering in the hallway. People are not even getting the dignity that they deserve to die. Even in the hall, people are stuck in the hallway for days and suffering, and it's just so devastating to watch. As a healthcare provider, we're just giving basic care. There are no resources to be able to provide quality care.
Birgit, some of the feedback I've received from viewers and people who read our stories online is, why are we covering this story now? I want to be clear, we've been talking to you for months, throughout the pandemic, before the election, but we're certainly hearing more about this now, about the challenges in emergency rooms and ICUs here in this province and across the country. Compare the situation now to a year ago.
Well, to a year ago, we were still short nurses, but it's just that right now, most of the nurses that were trying their best to hang in there just during the peak of the second or third wave are tired, they've quit. We were hopeful that there were going to be changes, that the government was going to repeal the wage suppression legislation, Bill 124, which had capped nurses' wages for a long time. And like with the increased workload, their pay is not commensurate to even what the current rate of inflation is. Inflation is at 8.1%, and our salaries are capped at 1%. So we're actually getting a pay cut despite increased workload. I'm telling you that one nurse is doing the work of 4 nurses. It's totally unacceptable. There's disrespect. There's absolutely no support. Nurses are breaking down. People have no mental health support. Even when these things happen, people are getting diagnosed with anxiety, post-traumatic stress disorder just from working during the pandemic. So a lot of people have quit. The conditions are way worsened. More nurses are leaving to go work in retail. It's just really hard because we're seeing nurses with over 2 decades of experience leaving the profession, and who's going to train the incoming nurses? This is not sustainable at this point, and of course things have worsened. We would have loved to see more attention just before the election so Ontarians can decide well enough. But unfortunately, we're getting all the attention now, but this situation has been there. Ontario has always had the lowest RN to population ratio in all of Canada. So this is only worsened, and it will get worse if nothing's done immediately.
Birgit, I want to tell you, about a week and a half ago, I asked the spokesperson for Health Minister Sylvia Jones if the minister thinks that and feels it is in the best interest of people of this province that the licensing for international nurses is sped up. I was told the minister is not responsible for licensing, it's the college. But then we saw, again this past week, that she sent directives to the college. She's giving them 2 weeks to figure out how they can speed up this process. Is that going to help? Because you mentioned, who's going to train all these nurses that come into the hospitals, these international nurses? I recognize they have expertise, but they're still joining a new workplace. Who's going to train them if nurses like yourself are already overworked and burnt out?
We would have loved to have a system that was working well to transition internationally educated nurses a while back.
Mm.
We have over 21,000 of them, and they're waiting there just to be able to practice. I teach in an internationally educated nurses program, and I teach nurses who have over 14 years of experience working across different countries except Canada, but they're not able to practice here. They're de-skilled to work as personal support workers, as Uber drivers, and I'm sure so many Ontarians that have seen nurses and doctors working in other fields besides theirs. So giving them 2 weeks, giving the college 2 weeks to transition nurses right now is unrealistic. It's not feasible. I don't even think the college has the resources to facilitate the transitioning of internationally educated nurses in 2 weeks. And when they get to the bedside, who is going to train them? Like I said, nurses have left. The experienced nurses that are able to train them have left. And when they eventually are able to transition, so let's say, how will they remain in the profession if they too will be met with Bill 124, wage suppression legislation, if they too will be met with disrespect, increased workload, how on earth will they stay? So yes, it is great to have internationally educated nurses, but the college has to have the resources to be able to transition them faster now. However, the working conditions must improve for them to stay, otherwise it becomes a band-aid solution, and we see this in cycles.
A good point. You can hire all the nurses you want, but if the situation in the hospitals and the supports for them aren't there, this crisis continues. Thank you so much, Birgit Umaigba, an ICU nurse who's always so generous with her time. Thank you, Birgit.
Thank you for having me.